Hello, everyone, and welcome back to the remaining of our Module 9 lecture. I wanted to touch on some things before we continue to talk about the urinary system. Last week, we talked a little bit about respiratory, and I talked about the labs, but I wanted to make sure that you knew the importance of how to put that bigger picture together while looking at respiratory, looking at the urinary system, which we're going to talk about. Which labs would you look at to tell you certain things about the patient? So when you talk about your respiratory system, what lab value would you look at? Would you look at the BUN creatinine? Would you look at the hematocrit? Would you look at the hemoglobin? I need you to know the difference between those so you can always match what's going on with your patient and you can look to see what those lab values are. So for example, when I'm talking about the urinary system, I want you to be able to tell me what lab values. So the BUN, blood urea nitrogen, is a measure of blood urea nitrogen, and it is not an oxygen carrying capacity. So don't want you to mix that up with the respiratory system. If I would ask you something about the respiratory system, I need to make sure you clearly understand that it deals with the kidney function. Okay? And also, I need you to know about hematocrit. Other labs too. So I want you to look at your CBC and your electrolytes, sodium, potassium, glucose. Look at those values and see how they relate to your patient. So I want you to know that with hematocrit, it is a percentage of the blood that is erythrocytes. Okay, and they contain the hemoglobin that carries oxygen. Okay, so how does that relate to my patient? So what does that mean? So when you talk about long-term hypoxia, so so if you have a patient who's in a hypoxic state or they have long-term hypoxia, so that condition may result in the body attempts to try to increase oxygen carrying capacity by doing what? Increasing erythrocytes production. So you knowing that detail, you know that if I'm talking to you about something that deals with respiratory, like we did the last class we had, where maybe the patient had an impaired gas exchange, that could be a nursing diagnosis, right? I need you to look at the lab values and see how do they relate to your patient. There's also another test called blood gas or arterial blood gas. So I need you guys to make sure you look up that because we're not coming to the class with questions, but I know my test exists of a lot of things that you guys are not asking me. So please look up blood gas. Know that that's used for hypoxia too. So these are lab values that are very important. And to get detail into the blood gas, I am not going to do that in fundamentals. But I want you to know like a particular test? Yes. So hematocrit, your blood gases, your BUN, your creatinine looks at your kidneys. What else? Well, not your blood gases. I was just mentioning that. Your blood gas and hematocrit, if your patient is hypoxic, you want to look at those lab values. Look at your liver function test if your patient is having liver problems, right? So, amylase and lipase if your patient is having some problems with their gallbladder or pancreas. So these lab values kind of tell you what's going on with your patient. And I know that we're supposed to talk about the urinary system, and I am going to talk about that, but that was kind of on my mind, and I want to make sure that we all understand that. One last thing, and I'm going to get started with the urinary system, and I apologize, but these are things that were just on my mind. I want to make sure that you guys understand ventilation. I don't want you to get it all mixed up with other things, okay? So how does atelectasis, for example, how does that affect your patient, okay? Atelectasis affects lung compliance. Please know that, which is a condition that needs to be present for adequate ventilation. Now, you do have alveoli gas exchange, and that's the diffusion of oxygen from the alveoli and into the pulmonary blood vessels. That can occur after ventilation though, after ventilation, okay? Look up ventilation if the word ventilation is getting you confused. I don't want to just spill out everything to you, so I want to put some knowledge in you and make you able to look up some of these things. Now, the transport of oxygen and carbon dioxide, it occurs where? In the blood. Yes, yes, yes. Very good. And then also, one more thing I wanted to talk on was systemic diffusion. Systemic diffusion of oxygen and carbon dioxide occurs between the capillaries and the tissues and cells. Okay, let's get started with the urinary system. Before I get to the next slide, I want to make sure that you guys go over the terms anuria, bladder retraining, blood urea nitrogen, which I talked about earlier, CODI, all of the terminologies on several pages, but you need to know creatinine clearance, dialysis, diuresis, diuretics. I'll pull up the book so you can see these, but you also need to know when we're in the hospital and the patient's complaining about urgency, urinary frequency or hesitancy, even urinary incontinence. You need to know the difference. You'll think like, aren't they all the same? No, they are not. So make sure you know the difference between urinary hesitancy, urinary incontinence, urinary retention. Okay, and let me find that page for you so you'll know, because the page numbers are right next to it in the book. Here are the terms, and the page numbers are next to them. I'm going to scroll up a little so you can see all the page numbers. Remember, I may scroll up fast, but you can always pause. And here's those page numbers, okay? So how does this apply to your patient? So you guys were asking me, well, how are the questions are? So if you had a patient in urinary incontinence, what are some of the things that the patient would be doing to say, oh, this patient has urinary incontinence, or by doing this, this patient does this, and this will cause urinary incontinence, or this patient is stating certain things that would say they have urinary frequency. So know what those are and apply it to your patients. So what are we doing in fundamentals, and what are we learning? We're learning urinary elimination, and we're learning all 7 of these. Please know that they all are important. We already went over the terms. We did go over the instructions last week, but I will show you a couple of pictures just to bring you back up to par. This is very important, intake and output of catheterization and a patient period with a catheter or without a catheter. We need to know that. But this actually stands for I&O catheter, which means that it goes in, stays a little bit, drains the bladder, and the catheter comes back out. I'm going to refer you back to your anatomy and physiology book for the structures, but I will tell you this as a nurse. We need to make sure that for proper hygiene, we're telling patients to wipe from front to back. Remember when we put a Foley catheter in that it takes a shorter amount of the tube to go in for the female, whereas basically the whole length of the tube, because the bladder is all the way up here for the male. So know those difference of how much of the catheter you should put in a patient. I'm not sure if I said this before, but you know how you know your anatomy, your ureters and your kidneys into your bladder and then out. Well, this is very important. I don't want you guys to take this picture and just keep going. Certain medications are metabolized in a glomerulus. Certain medications, certain diuretics are metabolized in the loop of Henle. So you need to know about how the anatomy is structured, so when you get a medication question, you know, is it going to hold on to the potassium or the electrolytes, or is it going to let the electrolytes and the potassium go? Where is it filtered at? All of those things are very important. This little box here is a wonder of a story. Just know this. Ischemia is lack of blood and oxygen to the organ. And look what happens. Wow. This young man who's sitting here, he is on a machine that acts for his kidneys, which is called dialysis. This machine actually is the filtering process of what we just talked about earlier with with the anatomy, okay? So the machine acts like our kidneys for us. So these patients will need this or else they won't make it. there are certain signs that tells us something is going on with our kidneys. I want you to read the small print underneath. Sometimes we can have urine and blood in our urine and we don't see it with the naked eye. But when we go under a microscope, we can see hematuria. So sometimes we can see it with the naked eye. Also, the blood would be, some people call it cranberry color. Sometimes you can actually see just blood or blood clots. Urine that is really, really darkened, or you can be amber in color, pus in the urine, different things, different bacteria are in the urine. So we have to make sure when we do our assessment, we just don't say, oh, this patient has a Foley catheter. We have to look at the color, if there's any odor, and so forth. So once again, look at this slide. What is our title? Oxygenation, perfusion, and circulation. Let's compare this to the next slide. And this is your take-home point. Nurses monitor urine output as an indicator of the renal function. It's all about, you guys, oxygenation, perfusion, and circulation. Read this slide, and it talks about preventing urinary tract infections, especially E. coli, which is found in our stool. So these are things that we can do to try and help prevent urinary tract infections. Now, here are some factors that influence urinary elimination. I'd like for you to read them because I just don't want to read them off to you. You see how this is in red? You need to know what nocturia, oliguria, anuria, diuresis, and enuresis, and polyuria means. Now, today I took care of a patient that was they had a factor that was bothering his urinary problem. So he had enlarged prostate. So he wasn't able to empty his bladder out completely. But guess what? That's a factor that influenced urinary elimination, right? In addition to that, the catheter was making him prone to UTIs, urinary tract infections. So he needed the catheter, but he was prone for infections. So it was like he was against two hard walls. So the best thing we can do is educate on hand washing and peri-care, along with catheter care. Here are factors that are affecting the elimination. Can you imagine if you had painful urination, you wouldn't want to go, right? What about some diagnostic tests? What about different positions? What if you were in bed and you were sick and you couldn't use the bathroom, but they wanted you to be on a bedpan lying flat? Wouldn't it be better to sit the patient up in bed? Different things, personal habits, how about privacy? If you leave out the room, maybe I can go, but I'm not going to go while you sit there and watch me. Different things. So look at all of these, and they do make sense, and try to take heed to it as you perform care with your patient. Now, we talked about catheters and passed them around in the room. If you have any questions about the catheter, securement devices, or the balloons, or the C1, 2, 3, or a three-way catheter, or normal catheter, or a three-way catheter, or where the catheter should hang on a bed frame, not the bed rail, good hand washing, wiping the catheter downward away from the meatus if they have a Foley catheter. Ask questions and I can help answer those, but I don't know what to tell you if you don't ask questions, as I'm thinking you understand all you're reading. Take a quick read on this urination that's found in your book. I believe it's on 175. I'm not 100% sure. 175, 174, one of those pages, or 177. I also wanted you to look on page 177 about the older adult. Oops, didn't mean to do that. I wanted to tell you, I am not to cross that out. So I wanted to tell you, I wanted to go underneath the older adult, and then also look here where the function of kidneys diminishes with what? I can't draw a straight line, so I apologize. It diminishes with age. But I don't want you to see, there you go. So you can see what I was trying to tell you, how it diminishes with age. This whole section, and pay attention to the nocturnal frequency, is good for looking at the older adult. Look at these medications that may cause urinary retention. I won't be able to read them all to you, but I wanted to squeeze in as much as I can within this 15 minutes. Another one I want you to read. This is found on page 180. I'm going to slide pretty quickly, but you can, oops, I didn't mean to go that fast though. But you can see where I'm trying to get you to see and understand all of the different ones. Let me see if I can get this Put my hand and go slowly. I need you to know these, okay? It's very important. I need you to understand and know them all. It's important in your nursing, not just knowing for a test, but it's important just knowing in your nursing practice.